your questions.
Mr. Chairman, members of the committee, I'm Michael Krawitz. I'm a disabled United States Air Force veteran. I've come over from southwestern Virginia just to speak on this bill. I think it's important to mention that I'm not paid, don't collect a paycheck to do the work that I do. But I've been advocating on behalf of veterans like myself and others for many years. I started out in the 1980s actually working in a veterans outreach in Omaha, Nebraska on Agent Orange issues. So this is actually not my first issue that I've come to, but it's a very important issue. And it's important for a couple of reasons that the doctor just mentioned. One is that we don't really have a lot of tools in our toolkit for some of the medical conditions that some of the veterans are suffering from. Post-traumatic stress, there just aren't that many medicines that are available. Neuropathic pain is another one that cannabis works very well for. There just aren't that many medicines available. I think it's important to recognize that I, like other veterans, are given huge bags of pills at the VA hospital. Go home and feel better, is what they say. And we try to use these medications. We try to use the non-medication treatments that they have available at the VA. And if we're saying that we're asking for medical cannabis, just please know that many of us and most of us are putting aside some very strong medications from the VA in favor for cannabis. And I think that's obvious proof that there's something of value to us there. And I just don't know what to say to you to really make you understand just how important this is. The fact is that I've suffered greatly. I am a disabled United States Air Force veteran myself, and I've gone through the ringer. And that cannabis is out there and it's available to veterans in states where it's legal. They have all these options of different types of medicines that they can use that are based on cannabis, and you don't have to smoke it. You don't have to administer it that way. If you have availability to some of these products, we're able to use it in other ways and get quite a bit of benefit. And I'm very tired, and I apologize for not having my thoughts together right now. It's a very upsetting issue for me.
You're doing fine.
I'm sorry.
You're doing just fine.
I just want you to know that this is the time to help veterans with this. And we aren't the only ones suffering, and we're not the only ones that are asking for this. But I think it's important to understand that the VA is on our side on this. Veterans Affairs, through my advocacy, I worked for about a decade in the VA on pain management issues, and the Veterans Affairs has passed a policy, 2010, to allow veterans in states where it's legal to use cannabis and integrate that into the care at the VA. The important other factor is that the VA, because they're part of the federal government, they're not able to handle the cannabis or recommend it. And that's put the ball in your court. The state has the power, the ability to handle this medicine, where the VA doesn't. And I ask you to help the VA, help the veterans.